Hello everyone. Today's video is about the treatment approach that I use to address Candida/yeast overgrowth. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So someone had asked a question on one of my other videos about how I approach yeast/Candida overgrowth. So I thought, what a great topic. I haven't talked about yeast/Candida in a little while, so here it is. So when it comes to, it's like, what's the difference between yeast and Candida? Yeast is, of course, a broad descriptor to describe a certain type of microorganism. Candida albicans is the best known or most popularized species of yeast, and it can cause a wide range of different health issues. There are other species of Candida that are out there. There are other species of yeast that can potentially cause issues for humans, but Candida is the one that kind of gets all the press. So, but they're kind of used synonymously or interchangeably in a lot of context. When it comes to yeast overgrowth, yeast overgrowth syndrome has been talked about for, over 50 years now. I believe it was in the 1970s. I think it was, oh my gosh, I think it was Dr. Crook was his name, wrote a book, I think, called The Yeast Connection, if memory serves. I'm sorry if I'm getting that wrong. Please correct me in the comment section if I'm wrong on that. Anyways, I believe it was Dr. Crook. He wrote this book many moons ago, and it really brought kind of the awareness of yeast overgrowth syndrome to the masses. This is back, of course, well before the age of the internet and social media and all those things. And so, people learn about things by reading books and reading newspaper articles, and man, what a simpler time it was in some ways. But thank goodness that we have access to more information now. I think it's ultimately a net good thing, but simpler times. And so a lot of folks over the course of time, they read Dr. Crook's book and saw that, like, I've got chronic fatigue, I've got chronic digestive issues, I've got recurring rashes, I've got constipation, I've got brain fog, I've got all these symptoms, one or more of these symptoms that are associated with yeast overgrowth, so I must have yeast overgrowth. And in some of those cases, the folks certainly did. Yeast overgrowth can cause any or all of those symptoms, but in some cases, folks don't have yeast overgrowth. So when a patient comes into my office and I'm suspecting there's yeast overgrowth, or they're suspecting they have yeast overgrowth, ideally we do a stool test to see if there's a yeast overgrowth in their intestinal tract. I really like the lab doctor's data. I have no financial affiliation with them at all. I just really like that lab. There are other good labs like Genova Diagnostics and others that are out there, but I really like doctors' data because they have a really good price point, and they have a test called the microbiology profile that not only tests for doing a yeast culture, but also they do microscopic yeast analysis. So sometimes the yeast doesn't survive the transit from the patient's home to the labs. So stool test, if I didn't mention that already, so sometimes doesn't survive, and so the culture will come back negative, but then they look for microscopic yeast, and I've had many patients where the culture comes back negative, they find lots of microscopic yeast, we treat for yeast, the patient gets better. So I think that microscopic yeast analysis is really important, and not every lab does that. I like the microbiology profile because it also measures probiotic levels and also looks for any commensal or dysbiotic bacterial overgrowth. So we learn about probiotic levels and also LIBO, or if there's large intestine bacterial overgrowth, or some pathogenic microbe like or bacteria like, say, Shigella or Campylobacter or Salmonella or something like that, which is usually pretty obvious if someone has food poisoning symptoms, but they test for them anyways, so why not? So if the stool test comes back positive, then we start treatment for yeast. Sometimes, no test is perfect, so sometimes even if the stool test says there is no yeast, then we might treat for yeast anyways. And then there is also the possibility of yeast overgrowth in the small intestine. So if the test comes back negative for the stool, it doesn't mean there's not maybe SIFO, small intestinal fungal overgrowth, which is kind of the weird name that they have given to yeast overgrowth, Candida albicans overgrowth in the small intestine. So sometimes we just treat empirically based on symptoms, but anyways, long and short of it is the stool test, to my understanding, in my opinion, is the best test. There are some other tests that are out there too. There's antibody tests to yeast. I really don't know how clinically useful those are. I don't run them, and they've just never really made much sense to me because, to my understanding, we all have yeast in our bodies. So if I have Candida antibodies in my blood, it's really just telling me that, like, I'm a human and I've got Candida antibodies in my blood. Maybe the levels of the antibodies are important, but it's just not a test I've really ever played around with, and it just never really made a lot of sense to me. So if you have contrary opinion, if you know things to be if I'm wrong in that, please post in the comment section. Let me know kind of where that counter opinion is coming from, because I'm always happy to learn, happy to be wrong. Life is a journey, not a destination. So, but that's kind of where I've settled on the yeast testing anyways. There are also some folks, some docs out there, some clinicians who talk about organic acid testing as being a really valuable test to look for yeast overgrowth, measuring things like arabinose levels and things like that on an organic acid test. I do organic acid testing with select patients, but I take the arabinose levels and other yeast markers with a grain of salt, because in my opinion, they're a much more indirect way of looking at whether there's yeast overgrowth. And to my understanding, it really hasn't been a validated test, at least not in like a formal research setting environment for yeast overgrowth. I've had quite a few patients where their arabinose levels are elevated, they have no digestive symptoms at all, maybe we have a stool test, no yeast overgrowth. It's just, I think there's some false positives with those types of tests. So anyways, all the testing thoughts aside, what are some of the treatments that I recommend for my patients when they're dealing with yeast overgrowth? Diet is oftentimes really important in helping to address yeast overgrowth. To my understanding and my experience, yeast really loves carbs, particularly refined carbs. So I'll usually recommend a similar diet for my patients with yeast overgrowth as I do for my patients who have small intestine bacterial overgrowth, which is typically a paleo type diet, where I recommend that they restrict their intake of complex carbohydrates. Depending on how severe their symptoms are, depending on the individual case, I'll usually recommend they aim for about an 80% compliance with the diet I recommend. Some patients do need to be stricter. Some can certainly get away with being less strict, especially if we're working with antimicrobials at the same time, which I'll get into in just a minute. But generally speaking, for my patients with yeast, I'll recommend they reduce their intake of complex carbohydrates like grains and starchy vegetables like potatoes and sweet potatoes and corn. And then with yeast, I also recommend that they be very cautious with their intake of simple carbs as well. So being really mindful of their intake of fruit and certainly fruit juices. I'll recommend minimization of that. And then I'm also will recommend that they significantly restrict their intake of refined sugar, and sort of things like high fructose corn syrup, and on the label saying things like glucose, fructose, being very cautious with their intake of, say, maple syrup and honey, which they can, if they can get away with it, use those as kind of alternative sweeteners to regular sugar, but really want to be careful with sweeteners in general. And some patients have to be really, really strict. In many cases, patients will come in saying, I avoid sweeteners at all costs because that really flares up my bladder symptoms, my fatigue, my brain fog, my digestive symptoms. So they're already kind of self-selecting in that way. They're already self-restricting in that way, but sometimes they're not. So we have a conversation about it. And then not with every patient, but oftentimes I'll recommend that they reduce their intake of dairy products with the exception of butter. Butter is largely just fat, so we don't really have to worry about the lactose or the casein content in there, but that's typically what I'll recommend diet-wise. So the reason behind that is that we don't want to be feeding the critters that we're trying to reduce the numbers of. So if one had an infestation of mice in their, say they were a farmer and they had a bunch of mice in their barn they wanted to get rid of, the farmer wouldn't put out a bunch of cheese if they wanted to get rid of the mice. They would do other things that were much less kind for the mice, like mouse poison or whatnot. Maybe some humane traps, I don't know. Depends on the farmer, how much time they have. They probably just get a cat. That's probably the faster option. But anyways, you don't want to feed the things that you're trying to kill off. So we restrict those types of foods to give less of a smorgasbord for the yeast. And then the other side of the coin is working with antimicrobials. So when it comes to killing yeast, oftentimes, I like a combination. There's a formula that's made by a company called Signature Supplements. It's called Dysbiosis formula. It's a combination of wormwood, black walnut, and grapefruit seed extract. So all really gross herbs to take outside of a capsule. They can be taken in tincture form and things like that, but I usually recommend the encapsulated form for my patients. And then, the dosage kind of depends on the patient's size and the chronicity of the symptoms, their sensitivity level, that type of thing, but it's a really nice combination formula that I found to be very effective over time. Sometimes we'll use herbal tinctures with different herbs in there. Sometimes we'll use other formulas. There are other agents like caprylic acid and laurelic acid. I've really never found those to move the needle a whole lot, so I used to use those once upon a time in my earlier years of practice. Never really found to move the needle a whole lot. Some clinicians will use drugs like nystatin and fluconazole, which can work really well. I've had a couple of patients over the years where they've just had no luck with anything but prescription meds for yeast, and that's made the biggest difference. have to be cautious with those because sometimes those drugs can be hard on the liver and like, well, the fluconazole anyways, and might not want to take that long term, but those pharmaceuticals can be really helpful especially in tough cases. But usually we just get away with using herbs and diet, and that will usually do the trick. There are some cases of really challenging yeast-related symptoms that require or have heavily benefited from using low-dose immunotherapy for yeast. I've posted lots of other videos about low-dose immunotherapy, also known as LDI. It's not the same thing as low-dose naltrexone, which is LDN, so I'm talking about LDI. So you can cross-reference those on my YouTube channel if you're so inclined, but that's sometimes very helpful. Over and above that, those are the main things. I mean, there's offshoots of this conversation where we could talk about things like exocrine pancreatic insufficiency that might require or benefit from exogenous pancreatic enzymes. There might be like a hypochlorhydria stomach acid deficiency component in some cases. Sometimes there are issues related to gastrointestinal motility. So if there's like a constipation tendency for some reason, sometimes we have to address that. Might require osmotic laxatives temporarily, or prokinetic agents. So there's other offshoots. But anyways, if there's more specific questions or anything related to yeast/candida overgrowth, feel free to post in the comment section below. If you don't mind, please taking a quick moment to like, share, subscribe, and or post a quick comment on the video. I'd really appreciate it. And any questions about any other topics, just post in the comment section and I will do my best to answer as soon as I can.